Maya Bowers, scanning the room, my workspace. There's my workspace. Hi, I'm Maya Bowers. I'm going to be your APN for today. How are you?
Good, how are you?
I'm good. Is it okay if I do a cardiac and peripheral venous system exam on you today?
Yes.
Okay, so first I'm going to have you just lay back. I'm having you lay at a 30-degree angle for this exam. The first thing I'm going to do is I'm going to shine my light on your carotids and your jugular veins. I'm looking for any abnormal pulsations or any jugular vein distension. And those are both normal, so that is good. The next place I'm going to look with my light here is called your point of maximal impulse. It's just down on your fifth intercostal space, mid-clavicular, right down here. Might have you lift your shirt just a little bit up there while I shine my light. Perfect. I'm seeing no abnormal pulsations there either. The next thing I'm going to do is I'm going to palpate your carotid pulses. I'm going to do one at a time. And I'm just going to feel for any abnormality. Perfect. Okay, your carotid pulses are equal and regular bilaterally. No thrills noted. The next I'm going to do is I'm going to palpate your angle of Lewis. That is where your manubrium connects to the body of your sternum. So I'm just going to start here and kind of feel and work my way down until I feel. Okay, right there. That is your angle of Lewis right there. The next I'm going to do is I'm going to feel various locations on your chest, feeling for pulses. So first I'm going to start in your aortic area. It is the second intercostal space down by your sternal body here. Okay. No abnormal pulsations there, no thrills noted. I'm going to walk my fingers over to the left second intercostal space. That's your pulmonic area. Feeling the same thing, no abnormal pulsations, no thrills. I'm going to use my fingers and walk down to the tricuspid. It's also on your left sternal border here. No abnormal pulsations, no thrills noted there. And then I'm going to go back down to that place I was shining my light on, and it is your mid-clavicular fifth intercostal space here. Perfect. I'm just feeling just a gentle tap there, but no thrills noted, no abnormal pulsations. Okay, next I'm going to grab my stethoscope here, and I'm just going to listen to both of your carotid pulses. And I'm going to use the bell on my stethoscope for that. So. Okay, just one at a time here. Other side. Perfect. I did not hear any breweries bilaterally. And then on those various locations I was just feeling, I'm going to listen with both sides of my stethoscope. First, I'll start with the bell here. Listening in your aortic area. Now to your pulmonic. Down to your tricuspid. And then down that mitral area again. Okay, switching sides, my stethoscope. Aortic area again. Your pulmonic area. Your tricuspid. And your mitral. Perfect. All of your pulses there were regular and equal, and you had a regular rate and rhythm, and I did not note any breweries there with either side of my stethoscope. So the next I'm going to have you do is kind of have you lay on your left side, and I'm going to listen to that spot that I shine that light on at the beginning. And for this, I am going to listen with the bell on my stethoscope. Perfect. I did not hear any S3 or S4 sounds. I didn't hear any murmurs in any of the locations on your chest there. So next I'm going to have you dangle your feet off, and I'm going to have you just lean forward for me. And I'm going to use the diaphragm of my stethoscope and listen in that same spot again. Perfect. No abnormal sounds there either. No, it was regular. So next I'm going to just inspect your arms. So I'm just going to take a look at both of them. Just looking at your skin tone here. Any abnormalities. Looking at both sides here. Perfect. Okay, I am noting that your skin tone is pink and even bilaterally. I'm not seeing any prominent veins. I don't see any rashes, scars. I do note a couple of tattoos there, but no abnormalities. So the next thing I'm going to do is I'm just going to feel some various locations of your arms here. First, I'm going to use the backs of my hands and just feel warmthness to make sure it's equal. Perfect. They are equal in warmth. I'm noting even hair distribution here. Next, I'm going to feel your radial pulses. Those are 2+ and equal bilaterally. And I'm going to feel your brachial pulses here. Those are 2+ as well and equal bilaterally. And then I'm going to go ahead and feel your epitrochlear nodes here, about 3 centimeters above this, above your elbow on this inner side. Does this hurt at all when I'm doing that?
Mm-mm.
Okay, so I'm noting no pain or tenderness. I didn't feel any swelling or anything with those nodes. So the next I'm going to just check your cap refill on your fingers here. So I'm just going to squeeze a few of your fingers. Your thumb. Your cap refill is less than 3 seconds, or less than 2 seconds bilaterally there, so that is good. Next, I'm going to inspect your legs, and I'm just looking again, kind of how I was looking for your arms, just looking at color, hair distribution. Can I have you stand up, and then I'm going to look kind of at the backs of your legs too. Okay, you can go ahead and sit back down. Your skin tone looks even. I only note just a few tattoos there as well. Looks like you have even hair distribution throughout your nail beds, and your skin is pink. So now I'm just going to feel various locations of your leg here. First, I need to start with your dorsal pedis pulses. Perfect. Those are 2 plus and equal bilaterally. So I'm going to move back here to your posterior tibial pulses. Again, 2 plus and equal bilaterally. I'm going to move up here to your popliteal, which is right behind your knee. I'm going to do one at a time. Okay, 2 plus equal. 2 plus equal bilaterally. The next pulse I need to feel is your femoral pulse up here. So I'm just going to try and feel just right up here under your shorts. And then this side as well. Those are 2 plus and equal bilaterally. I'm also going to feel your groin for any inguinal nodes here. Is there any tenderness?
No.
When I'm doing that? Okay. All right. I do not feel any swelling in these nodes, so that's good. Okay. Next, I'm going to use the back of my hand, feel for warmth. And I'm going to check the cap refill on your feet here. Other foot. Okay, your cap refill is less than 2 seconds bilaterally, and your the warmth throughout your legs was equal as well. The next thing I'm going to have you do, it's called the Allen test. I'm going to occlude both your ulnar and radial arteries on your wrist, and I'm going to have you pump your hand a few times until it turns kind of white in color. So go ahead and pump. Okay, I'm going to release your ulnar side here. Okay. I'm going to hold again and have you do that one more time. Okay, I'm going to release your radial side. Perfect. The pinkness in your hand came back in just a few seconds after releasing both of those sides. So we're going to do this to your other hand. I'm going to hold again and have you squeeze. Okay, I'm going to release your ulnar side. Perfect. Squeeze again. Okay, releasing your radial side. Perfect. Same result. The pinkness in your hand came back with just a few seconds. The next test I'm going to have you do, I'm going to have you lay down, and I will have to lift your legs up to a 60-degree angle, and I'm just going to hold them up until your feet turn kind of pale. It's about a minute or so that they have to be up like this. Okay, in just a few seconds, I'm going to have you sit up and swing your legs over and kind of dangle them off the edge of the bench. What I'm looking for is I'm expecting the pinkness in your feet to come back in about 10 to 15 seconds. Okay, go ahead, swing over. Perfect. Okay, the pinkness in your feet came back, so no insufficiency there. That concludes our exam today. Thank you.